everyone, Dr. Jesse here, and today we are going to be reviewing several posts made by Be Strong Physio where he suggests that posture is not associated with pain. Now, this is important because here at Optimizing Health, we often make recommendations to patients about posture and their pain, and honestly, daily we hear complaints from patients that their low back pain increases as they've been sitting for too long in a flexed or slouched, hunched over position. So let's go ahead and start with Be Strong Physio's video.
Red flag. Red flag. Red flag. Red flag.
You see there that he states it is a red flag and you are not receiving good care if your provider suggests that your pain is caused or associated with your posture. Now, he doesn't provide any evidence to support this claim, but if we go ahead and take a look back at some of his older posts that are similar to this, we see that he does offer some research to attempt to support these claims. Now, unfortunately, this research that he uses is only about lifting posture and pain. And one of them is primarily on elite athletes, which is honestly useless to 99% of the population. And it's really inappropriate to be extrapolating data from studies on athletes and using that for recommendations for the general public. Now, he does use another study that's a lot better on manual labor workers. And in this study, they took a group of manual labor workers with low back pain and without low back pain and had both groups go ahead and lift a box 100 times and assessed their lifting posture. Now, what this study found was that people with low back pain are more likely to lift what is generally recommended as ideal lifting posture, such as lifting with your knees, not your back, keeping that back a little bit more straight instead of rounded. Now, if you hear this, it sounds pretty convincing that, well, shoot, maybe posture isn't associated with pain, but sadly, that can be further from the truth. And this is pretty easily explainable by reverse causation. Now, by reverse causation, what I mean is that people with low back pain most likely start to lift with better posture to try and help counteract that pain that they're experiencing with their lifting to an attempt to avoid that pain. We can also look at studies on sitting posture and pain, which demonstrate that people with low back pain commonly sit with too much of a flexed posture or even an actively extended posture, meaning that there's two postures causing pain here. And we can even look at other research that uses a lumbar roll, which is a lumbar support, to passively create an extended sitting posture versus an active one. And what those studies find is that that type of sitting posture with the lumbar roll alleviates pain. We can take this a step further and look at studies on cumulative flexion and its relationship to pain. And what we see with that is that every hour spent in flexion, your likelihood of developing low back pain increases by 1.29 times. Now, keep in mind that this study here is a case control, so it likely overestimates that association, but nonetheless, we can go ahead and look at similar research that finds that avoiding flexion and having more of an extended posture throughout the day is associating with having less reoccurrence of back pain. And let's go even further than that. Let's look at the effects of poor posture on muscle activity. And when we do this, we see that prolonged flexion sitting causes a flexion relaxation phenomenon, which decreases the extensor muscle activity of our low back. And we also see that in manual labor workers with flexion provoked pain, those individuals have less muscle endurance of those same muscles. Now, instead of extrapolating from studies on athletes, let's take a look at the totality of evidence and use that knowledge as a whole in a clinical setting to make a decision on a patient where we are much more likely to see a person who is, one, overweight, living a sedentary lifestyle, sitting most of the time, typically in a flexed position, and let's say that individual also works a construction job. Do we really want to go ahead and tell them, yeah, it's fine to lift that heavy work equipment with your back completely rounded because a strong man can do it and they don't have pain, so you shouldn't either. No, we would never want to do that. What we do want to do is consider all of these factors that are predisposing this individual to being at risk of injury by doing that type of lifting, and recommend better postures on top of everything else that we'd already do with this patient, such as rehab and other treatments, whether that's adjustments or dry needling. So clearly there's a much larger role that posture plays in pain than Be Strong Physio's post were indicating. If you found this video helpful, go ahead and let me know by leaving a like. Let me know in the comments what you think. Does posture give you pain? Or am I wrong and you agree with Be Strong Physios?